Everyone. Happy Saturday night. We're going to go ahead and get started, especially for the sake of time. So this portion, we're going to be focusing on next generation NCLEX style questions. So always remember, everything that we're doing is not just for the exams, it's not just for NCLEX, but these are things that you're going to be seeing every day, especially in clinical practice. So our main topic today we're going to be focusing on, of course, is going to be deep vein thrombosis, DVT. Now, it's going to be very, very important because this is always a major topic that you're going to see over and over and over again for different types of patients. So this case study is set up to really address that issue. So this is going to be an example of what you need to be paying attention to, and also to help you with how you study for the case studies. And remember, on your NCLEX, you're going to have a minimum of 3 case studies. Each case study is going to have 6 parts, okay, that are all related to the issues that you're going to see with one patient, okay? So let's go ahead and get started. So it says the nurse on the medical surge unit is caring for a 69-year-old male client with pain and swelling of the right lower extremity. So pay attention to the day and the time that you see on the note. So this is an admission note. The client admitted from the emergency department via stretcher and transferred to bed. The client is alert and oriented. Saline lock IV and the right antecubital vein, and it's patent. Right lower extremity noted to have 2+ pedal edema. Pain 8 out of 10 in the right calf. Warmth noted to right calf. Client has positive motion and sensation to right lower extremity. Right pedal pulse is weak but palpable. Right lower extremity elevated on 2 pillows. The vital signs are blood pressure 145/82, heart rate 96, respiration 16, and a temperature of 36.7. The client ordered to be on complete bed rest. Client made aware. Based on that, which 4 findings are most concerning to you? So out of the list that they give you, you have to pick 4. So is it 2+ pedal edema, pain 8 out of 10 in the right calf, warmth noted to right calf, positive motion right lower extremity, the right pedal pulse is weak, the right lower extremity is elevated, the blood pressure 145/82, the heart rate 96, or the positive sensation in the right lower extremity? You, so that way you can really see what's going on. Everyone hear me okay?
Yes, I can hear you.
Okay, good. Again, a big part of these case studies, so you know, is going to be making sure that you have a firm grasp of assessment skills. Can you pick up changes? Do you know any abnormalities and vital signs? So key things. So everybody generally have an idea? Okay, see some is there? Okay, good. So again, this is kind of the things when you're looking for most concerning, right? You're looking for the things that would worry you as the nurse. Okay, you're looking for abnormal findings. So let's go through this one. So the most concerning would be the 2+ pedal edema, the pain 8 out of 10 in the right calf, the warmth noted to the right calf, and the right pedal pulse is weak. And the biggest thing you want to remember, when you look at certain things, right? This was part of the test taking strategies that we had. Part of test taking strategies is looking at things that are expected. Don't pick things that are concerning that are within normal limits, okay, that are normal. If you look at the heart rate, that's between, a normal heart rate is what, 60 to 100, correct? The heart rate is what, 96. Is that normal? It's normal, okay? So be very mindful to pay attention to things that are abnormal. That's what it's asking you. We are concerned about things that are abnormal, okay? So again, you should recognize the following as signs of a possible DVT. And remember, whenever you're assessing extremities, you're looking for pain, paresthesia, pulselessness, pallor, pocothermia, meaning how if it's cold, okay? If it's cool. And then of course any paralysis, numbness and tingling, okay? So the pedal edema, the calf pain, the warmth to the right calf, and a weak pedal pulse. Remember, whenever your pulses are getting weak, that's never a good sign, okay? So the positive motion and sensations are expected. I want those things. They're normal. Blood pressure and heart rate, again, are a little borderline, but again, the heart rate is not my concern, okay? And the blood pressure is probably high because the patient's in what? Pain. It's an 8 out of 10. The right lower extremity and bed rest orders must be followed, okay? But are not overall concerning about the client's health condition, okay? So again, it's very important because again, this is pretty much something that you really want to make sure, because again, this is graded on points, okay? So please make sure when you're assessing extremities, and this is going to help your studying, okay? If you miss this, if you're missing your assessment skill, if you don't know your 6 Ps, these are always part of your neurovascular checks for patients, okay? Make a note, add it to your laundry list if it's something that you're not really familiar with, okay? You want to make sure when you're studying, when you're assessing extremities, especially the lower extremities, you have a firm grasp on the assessment. So good job on that one. So that was question 1. So the second part, and I want to make sure you guys understand, right? Because again, when people have issues with their veins, they're going to be very prominent, okay? So you really want to pay attention to these particular findings. So number 2, the nurse on the med-surg unit is still caring for the same 69-year-old male client with pain and swelling of the right lower extremity. As you can see, the nurse's note is still the same, okay? But it's now asking you an additional question. For each potential assessment finding, click to indicate if the finding is consistent with a deep vein thrombosis, a soft tissue injury, or an infection. Each finding may be consistent with more than one condition. So when it comes to these particular issues themselves, okay, you want to make sure that you pay attention to these particular factors. And a lot of the case studies are going to bring up multiple conditions. So it's testing your knowledge on, are these findings that I see in a patient with DVT? Are these findings that I see in a patient with soft tissue injury? Or are these findings that I see in a patient with an infection? So is edema a sign and symptom of DVT? Is edema a sign and symptom of soft tissue injury? Is edema a sign and symptom of an infection? They want you to go through each of these and answer the question. Is a weak distal pedal pulse a sign and symptom of DVT? Is a weak distal pedal pulse sign and symptom of soft tissue injury? Is a weak pedal pulse a sign of an infection? Is pain to the right lower extremity a sign of a DVT? Is it a sign of a soft tissue injury? Is it a sign of an infection? Is warmth to the right leg a sign of a DVT, soft tissue injury, infection? Do I expect limited range of motion with a DVT, soft tissue injury, and an infection? So go through based on your knowledge and see, And then you would click the ones that you think these are signs and symptoms, yes. These are signs and symptoms of this, yes. These are signs and symptoms of this, yes. It tells you each column must have at least one response option selected. Everybody getting a firmer understanding of what to expect? Yes. Okay, yeah. So you go through, and that's what they want for you to see. When do I see edema? Okay, DVT, soft tissue, and infection. When do I see weak pedal pulses? So this is pretty much the differential diagnosis. They're testing to see, do you understand signs and symptoms of different conditions, different issues? Next generation is all about critical thinking. Okay, so let's work our way through. So it's very important when you guys are studying, you pay attention to signs and symptoms. So edema, we see edema in all three. Remember, when people have infections, right? Cellulitis, anything with an itis, you have infection and inflammation. Remember, infection brings inflammation. The area becomes what? Erythema, red, swollen, painful, okay, with an infection. A weak distal pedal pulse is only seen with a DVT. It's not seen in a soft tissue injury. It's not seen in an infection. When patients have pain to the right lower leg, we can see it with a DVT and a soft tissue injury. Okay. And a soft tissue injury is pretty much sometimes when we see issues like with a sprain or a strain. Also, same thing with an infection. When something is infected, it hurts. Okay. We can see warmth to the right calf with a DVT and, of course, with an infection. And a limited range of motion is only going to be seen with a soft tissue injury. Okay, like a sprain or a strain. Now, you want to make sure you understand what soft tissue injuries are, right? Those are things like a strain or a sprain. It's not a fracture. Things that affect my soft tissue. Okay. So this is one of the types of questions you really want to start getting comfortable with. And you can see how it's really testing your girth of knowledge. And remember, these are basic assessment findings you want to get very comfortable with. Okay, especially with DVT, especially with infection, because you know it's always going to be on your boards. So let's do the third question. The nurse, same patient, same question. Remember, this is all about the same question, okay? Same patient. So now, if this is an example of a drag and drop, drag the most appropriate word from the choices to fill in the blank of the following sentence. The nurse should recognize that the client is most likely experiencing, is it a cellulitis of the right lower extremity, right leg deep vein thrombosis, sprain to the right leg, or osteomyelitis to the right leg? It's your answer. So based on your assessment, based on what they gave you, okay, right leg DVT. But you can see how the other things that they're trying to put in there, like cellulitis, infection, osteomyelitis, infection, sprain, soft tissue injury. So when you're studying, are these topics that you should pay attention to? Cellulitis, osteomyelitis, sprains, strains? Yes. Because we don't know what the patient has, right? But based on the signs and symptoms, I could probably narrow it down. Yes, they have very similar symptoms. Okay, so I pay attention to that. That's how medicine works. This is like pretty much what the doctors and the practitioners are doing. They're doing a differential diagnosis. Based on this, what are the possible things the patient can have? Okay. So as nurses, we want to make sure that we're critically thinking as well. Okay. Good job. So again, you want to pick the one, and this is where you just drag it. And these are kind of nice, right? Because then, of course, you just get the point for making sure that you can recognize the sign and symptoms of a DVT, right? So again, you always want to make sure that you're able to identify what's going on with the patient. And remember, the biggest thing when it comes to a DVT, right, in the particular area, right, it's not really an arterial issue, but we're still having issues with what? Blockage. Okay, we have blockage, right? And we have to be thinking of the complications, right? When things don't flow appropriately, when I don't have my RBCs, right, and they carry my oxygen, when I don't have perfusion and oxygenation to an area, that tissue is gonna what? Die. Okay, so always be thinking about those particular issues, right? I want everything going and flowing normally. So let's look at question number 4. So same patient. Now look at the time. It's 10:10. And remember, everything we do in medicine is what? Timed, right? Especially as nurses. So you admitted the patient at 9:30, you did your note. It's 10:10. Okay. Radiology called results of the right leg ultrasound. It came back positive for deep vein thrombosis of the right posterior tibial vein. The provider was made aware. New orders are pending. So again, there were signs and symptoms. How do we know 100% that it wasn't osteomyelitis, that it wasn't a sprain, that it wasn't cellulitis? Diagnostic test. The diagnostic test it gave you was an ultrasound, okay? And it came back positive. So the nurse's notes have been updated with the most recent radiology results. For each potential intervention, click to specify whether the intervention is indicated or not indicated to include in the patient's plan of care. So now that you know 100% that it was diagnosed as a DVT from the diagnostic test, tell me if you're supposed to do these things or you're not, based on the patient's diagnosis. Am I supposed to obtain a partial thrombostin time, a PTT? Okay. Or is it contraindicated? Should I begin anticoagulation therapy? Is that indicated for patients with DVT or not? Should I apply compression stockings to bilateral lower extremities? Is that indicated or not? Should I ambulate the patient 3 times a day or not? Should I elevate the right lower extremity or not? Should I massage the right lower extremity 2 times a day or not? So this is them testing. Do you know how to take care of a patient with a DVT? Do you know what to do? So there's some labs in here. There's some other non-pharmacological interventions. And these are basic nursing interventions, okay, when it comes to a DVT. So you want to make sure you go through and you're very firm on this, okay? So when we look at this particular type of question, do I want labs? Yes. Yeah. I want to know about PTT, INR, H&H, WBCs. Do I want to begin anticoagulation therapy? Yes. Right? Because what's going on? There's a clot, right? So I need to make sure I prevent further clots. Do I want to add some compression stockings to the lower extremities? Yes, I do, right? Prevention. Should I ambulate the patients 3 times a day? No, that goes along with not massaging it. If I do that, what's going to happen? If I walk the patient 3 times a day, if I massage their leg, embolism, I'm going to dislodge the clot. So again, you should anticipate that they're going to order anticoagulation therapy, right? It'll probably be a bolus dose of heparin followed by a continuous infusion. And for you to know that heparin, the test for heparin is what? PTT. And that's going to be consistent monitoring, okay, every 6 hours per protocol. The compression stocking and elevating the right lower extremity are indicated, okay? We don't want to ambulate until anticoagulation has begun due to the risk of mobilizing the venous thromboembolism, okay? Again, it's very important, but you can see how they're asking you to critically think in different ways. They want to see, are you going to move this patient? You going to massage this patient? Because remember, they're trying to make sure that you understand the basics, that you're going to be a safe nurse. So I know this is very different than the basic multiple choice and the basic select, all that apply. This is next generation NCLEX. But when you really have a firm grasp and you have a good understanding, it makes it a lot easier. What if they added a choice of the patient taking heparin? Do you give the patient protamine sulfate? What is protamine sulfate? Good. It's the antidote for heparin. They can ask you so many different things about this one question, right? So you want to make sure that you have a firm grasp, right? Because that would be contraindicated. I want to give protamine sulfate. I need to give the heparin, right? So again, this is a way to make sure, am I studying the right way? Does it make sense? Okay, this is you connecting the dots. Move on to the next question. The nurse on the med-surg unit, same patient, swelling, so on and so forth. You can see it keeps the notes together for you, okay? So that was 10-10, right? We got the radiologist report that it came back positive for DVT of the right lower posterior tibial vein, okay? Now at 10-18, the doctor gave you orders, okay? This is what the doctor orders. For labs, they want you to draw your PT and your PTT stat. They want the medications the doctor ordered. Administer heparin 80 units per kilogram IV bolus now. After initial bolus, begin heparin-based protocol, continuous IV infusion. Starting dose 18 units per kilogram per hour. You draw the serum PTT 6 hours after the infusion begins, then 6 hours. Call the doctor with the results. Your nursing orders include strict bed rest, patients not moving, place compression stockings on bilateral lower extremities, elevate to right lower extremity, closely monitor for signs of bleeding. Those are your orders. So you review the physician's orders. For each order, click to specify if the nurse should implement the order immediately, within the next hour, or at least by the end of the shift. So based on the order, I see a couple keywords there, right? What are a couple keywords that make you think immediately? That, okay? So I look at the stat orders that I'm going to implement, right? Now, stat, okay? Now this is them seeing. Remember, when you're a nurse, nobody's guiding you. Nobody's telling you what to do. You go by your orders, especially if they stay stat, and now those help you, right? But the order of things are going to be up to you. So when I look at these particular things, do I draw the PTT immediately? Was that a stat order? Was the administering the heparin a stat order? Can I do it within an hour, or do I do it at the end of my shift? Okay, begin the heparin at 18 units. We draw at 6 hours, strict bed rest, placing the compression stockings, elevating the right lower extremity, and closely monitoring for signs of bleeding. So by each one, you want to start figuring out, okay, I'm going to do this right now, this can wait. the hour, it's still important. And this is important that I do it at least before the end of my shift. So what are the two stat things that you would do right now? So when we look at this, okay, so you're going to draw the PTT, that's immediately, okay? And then you're going to place the patient on strict bed rest. It's very important that you tell the patient not to what? Get out of bed. Because patients like to move, okay? Now, after you draw the first PT, right? Then within the hour, you have to start giving your what? Your medications. Okay, you're going to administer heparin 80 units, kilograms per IV. And then you're going to begin the infusion. Okay, you're going to give the bolus, and then you're going to start the infusion. You're going to elevate the right lower extremity, and you're going to monitor for signs of bleeding because you did what? You started a heparin infusion. Anytime you have any anticoagulation therapy, we monitor for signs and symptoms of bleeding because that's an adverse effect. Okay. And before the end of the shift, you're going to redraw the PTT within the 6 hours, and you're going to place the compression stockings on the right lower extremity. Look at these particular choices. You should pay attention to that. The nurse should have the PTT drawn immediately since it's a stat order, and the heparin cannot be started until that order is done. Okay. Now it's very important that you understand the sequence. Draw it, and the value that you get, okay, has to be based on the labs that are drawn. Both the bolus and the initial infusion of heparin should begin within the hour to prevent the DVT from spreading. Then you're going to withdraw the PTT 6 hours after the initial dose per the doctor's orders. Strict bed rest should begin immediately because you all told me if I move that patient, if I massage that patient, they're going to be at risk for what? Yes. So when you see the word strict, that should alert you as well. Strict eyes and nose, strict daily weights, strict bed rest. That means right here, right now, that's an order. That means if I don't adhere to that, it can have complications. And remember, it's the complications that kill people. So again, the compression stockings will likely need to be obtained from the supply area, and as long as you get them by the end of the shift. And you want to elevate their right leg sooner than later, but it's not the first thing, okay? You're always going to monitor for signs of bleeding, okay? But you don't monitor for signs of bleeding until the medication that causes the bleeding has started, okay? So you do kind of all of those things concurrently. So that was just the next part of the case study. So we look at all of these orders that the doctor gave us, and you can see we're following the time, okay? So the next part of the question says, the client is reassessed on the third day and discharge orders are received. Which client statements indicate the teaching was understood? Select all that apply. So the patient's been there for 3 days. They've been getting their heparin, probably doing a lot better, no issues. So look at the question, look at the stem. Which client statements indicate the teaching was understood? So I'm looking for everything that the client is saying that is wrong or that is right. Right. Okay. And these are the things you pay attention to because you're going to see the question could have been worded, which client statements indicate a need for further teaching? Then I would be looking for something that is Wrong. So you really want to pay attention to how it's asking you the question. So, and I like to select all that apply, test taking strategy. You do it as true or false. So is it true or false that to relieve my stress, I should have a glass of wine before dinner if I've had a DVT? Is it true or false I will eat more spinach and kale every day? True or false if I've had a DVT? Is it true or false I will throw away my straight razor and buy an electric one? True or false? Is it true that if I miss a dose of my medicine, I will contact my doctor? Is it true or false that controlling my blood pressure is not important? Is it true or false when I travel, I will get out and walk every 3 to 4 hours? Is it true or false that I had a DVD and I understand that I have to set an alarm so I take my medicine the same time daily? So you want to go through each one and say, is this correct for a patient with DVT? Is this true for a patient with DVT? This is very important, right? If the patients aren't taught appropriately, where are they going to end up? If we discharge them and they don't have a firm understanding of what to do and what not to do, they're going to end up back where? In the hospital. Yep, right back in the ER. That's why discharge teaching is so important. And this is a critical component when it comes to your boards. So when we look at these particular choices, the ones that are correct are, I will throw away my straight razor and buy a what? An electric one. Do we want a patient using anything with blades that's on anticoagulants? No, they need an electric. If they miss a dose of their medication, should they call their doctor? You better bet your bottom dollar yes. Because remember, the anticoagulation therapy builds up. Okay, it's labs. So that's a problem. And should they set their alarm to take their medication every day? Yes. Do I want the patient having a glass of wine before dinner? I know sometimes I say a glass of wine is fine, but for this particular patient, can it be an issue? Can it interact with the medication? Should they be eating spinach and kale every day with the medication that they're on? No. Is controlling their blood pressure very important? Yes, very important. The risk for DVT is related to blood pressure. When they travel, should they get out and walk every 3 to 4 hours? Risk for clots, risk for embolism. So this is testing your ability to really understand and make sure that you teach the patient. Teach them. Make sure they know what's going on. Okay. So when you have the patient, when they're traveling, especially on an airplane, you that they're circulating, okay? So it's about 1 to every 2 hours while they travel. But the education, the critical part is, can they have an active DVT and be moving? No, no. Once the DVT has cleared, do I want them moving? Yes, because the blood is what? Moving, it's circulating. Part of a DVT is that the blood pools, right? And there's no movement, there's no circulation. Okay. So again, you want the client to maintain a healthy weight. You want them to control their blood pressure to reduce the risk of DVT. They should also avoid alcohol due to the blood thinning properties associated with alcohol that's combined with warfarin therapy. The client should avoid green leafy vegetables. They contain vitamin K, and that could decrease the therapeutic effect of the warfarin. Due to the bleeding risk, the client should use an electric razor. Again, it's always important that they take their medication at the same time every day. And if they miss it, they need to call their doctor. So let's do a classic new next generation question. It's a bow tie question, okay? So when we look at this, same patient, signs and symptoms, the client arrived in the emergency department, triage. It's 15:20. The client arrives by ambulance to the emergency department with difficulty breathing, sharp pain in the chest on inspiration and cough. Onset 2 hours prior to arrival. Lung sounds are diminished bilaterally. The client has become diaphoretic, tachypnic, using their accessory muscles with inspiration. The vital signs, blood pressure 166/103. The heart rate is 122. The respirations are 36. The temperature is 37.2. The pulse ox is 88 on room air. The client is immediately placed in a room. Provider is called to bedside for rapid assessment. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions that the nurse should take to address that condition that you pick, and 2 parameters the nurse should monitor to assess the client's progress. Remember, this is to make a bow tie. So whatever I pick in the blue, the potential condition has to match the left, which is my actions to take, and the right, parameters to monitor. So based on this patient, the one that had the history of the DVT, they come into the ER like this. What do you think is going on with them? Getting some answers there. So you got to tell me, is the patient having, is this signs, symptoms of pneumonia? Is it an MI? Is it a pulmonary embolism? Is it a fat embolism? So based on what I pick, remember that potential complication is the middle of your bow tie. So everything has to be related to whatever your answer choices are. So great, everybody says it's a PE. So if I think it's a pulmonary embolism, actions am I going to take? Am I going to place the client in a high Fowler's position? Am I going to titrate oxygen to maintain the O2 sat between 99 and 100? Am I going to administer broad spectrum antibiotics? And am I gonna obtain 2 sets of blood cultures, or I'm gonna prepare the client for a stat CT of the chest? And then based on that, what am I gonna monitor? Am I gonna do hourly ABGs? Am I gonna do continuous non-invasive blood pressure monitoring? Am I gonna do respiratory status? Am I gonna do renal functions? I'm gonna do continuous cardiac monitoring. And remember, your parameters to monitor have to match what you picked. So PE. All right, I'm seeing some good answer choices there. But do you see how they need you to think? This is all related to one. This is one case study. So next generation is really about, this is a real patient. These are the things that are happening with them. This is how we work as nurses. Good. See if you're right. Pulmonary embolism, great. What do I want to focus on? And I know this one gets people a lot, okay? The titrate oxygen to maintain the O2 sat. But the actions to take immediately are to place the client in a high Fowler's position, okay? And of course, prepare them for a stat CT. So again, the most common complication, and remember I told you it's the complications that kill people. You see how critical he is? PE is the most common complication from a DVT. So again, the clinical manifestations of a pulmonary embolism are difficulty breathing, inspiratory chest pain, and a cough. So you should elevate the head of the bed in a high Fowler's. Position promotes what? Oxygenation. Don't forget your positioning. And remember, this is a test-taking strategy. We do least invasive to what? More invasive, right? Don't forget your position has power. That high Fowler's, promoting the chest expansion. So we're going to prepare them for stat CT to confirm the diagnosis. That's what's going to reveal the pulmonary embolism. Oxygen is needed. However, the goal is to maintain an O2 sat of 95, not 99 to 100. And I don't know if you guys have been seeing this in clinicals. When doctors write orders for O2, do you see a range? What's the normal range that doctors write for O2 orders for the patient to be satting? It's 95 to 100. Yes, 95 to 100. So you can see how that caveat can make you pick something that's not correct. To be setting 99 to 100. But the orders that you see for titrating oxygen is 90, maintaining O2 sat 95 or greater. Okay. So again, I want to be realistic. If they're at 88 and if they got to 95, would that be good? Yeah, be good. They're doing better. Okay. Antibiotics, blood cultures are for what? Are not indicated. It's for pneumonia. ABGs are indicated. However, I'm not doing hourly ABGs because ABGs come from where? The patient. That means you're sticking them every hour. Unrealistic. Again, the respiratory rate, pulse ox, and cardiac monitored should be followed closely. Blood pressure should be checked frequently, but not continuously. And the renal function should be checked prior to CT without contrast, but it's not the highest priority for monitoring. So my priorities, remember, airway, breathing, and circulation. This is a direct issue with the what? The lungs. Sure, I'm checking their heart. Airway, breathing, circulation, my two vital organs that I have in my thoracic cavity, lungs and heart. So that's a classic bow tie question. So part of this case study was to really get you to figure out, how do you answer these types of case studies? How do you study? Master and learn the content. You can see how, if you have gaps in your knowledge, can you answer these questions? If you don't know what's going on with a PE, you don't know the signs and symptoms of a DVT, can you successfully complete the case study? No. Okay. The biggest thing with students, and I'm telling you, learn the material first. I know there's so many questions in test banks. There's Archer, there's UWorld, there's this, and that. If you master content, there won't be anything you won't be able to answer. So when you study content, what is it? What is a DVT? You have a vein, and then you have the deep vein thrombosis, right? In the patient, and you do it by assessing the extremities. Okay. A deep vein thrombosis and pulmonary embolism are often undiagnosed, but they're preventable conditions. Okay. A DVT is a medical condition that occurs when a blood clot forms in the deep vein. The major areas we see this are the lower leg, the thigh, and the pelvis, but they can occur also in the arm. Okay. And remember, a DVT can happen to anybody and cause serious illnesses, disability, and can it kill a patient? Yes. because it can get stuck in my lungs. It can go to my brain and cause a stroke. So the biggest thing is to see what is it, the signs and symptoms, can I diagnose it, and who's at risk? Okay. When we look at the different patients, right? When we look at the risk factors for a disease process, especially DVT, who's at risk for a DVT? Your adults are increased risk for DVT because, again, the limited mobility, multiple comorbidities, they often have high blood pressure, diabetes, heart disease, cardiovascular disease, false positive D dimers, increased venous stasis, and the use of estrogen containing drugs, right? So that high estrogen, because a lot of time older women are going through what? Menopause, right? So they have to balance their estrogen levels. Being older, so again, over the age of 60 increases the risk of DVT. Lack of movement. So does that include all my patients who have had surgery, who are on bed rest, who are immobile? Yes. Injury, surgery, pregnancy. Because what's happening when women are pregnant? They get that extra weight. They get the pooling. Okay, they need to be walking around. Birth control, placement therapy, people who are overweight or obese, people who smoke, people who have cancer. The more risk factors you have, the more the likelihood you're going to develop something. So please know your risk factors for a disease process. When you're studying, who gets this? And make sure you understand what? How things are diagnosed. How is a DVT diagnosed? Besides the signs and symptoms, they're going to send them for what? A duplex ultrasound. So it's an image and it creates all those waves and it shows the blood flow in the vein. So it can detect those blockages. So it's the standard imaging test for a DVT. And remember, no disease process can be diagnosed without what? Test. Learn the test when you study something. How is a patient diagnosed? They're not diagnosed until the tests come back what? Positive. And another test you need to make sure you're familiar with for DVT is a D-dimer. It's a blood test that measures, again, a substance that's released when the clot breaks up. So a D-dimer and an ultrasound. Okay, when those come back positive, it means the patient has a DVT. So we look at the treatment options, right, for DVT. What are the important things that I have to know? The treatment options for acute DVT are based on the size of the clot and how long it has been present. The standard of care for the treatment of acute DVT is anticoagulation therapy, right? Heparin and Coumadin. Cannot stress enough. Those are two drugs you need to know like the back of your hand. Millions of people take these medications every day. Okay. So when we study, right, when you study a drug related to a disease process, like Coumadin, it is given PO. It takes time to work. So they're going to be probably getting heparin injections and infusions until the Coumadin can start working. Okay. What's the antidote for Coumadin? Vitamin K. And I highly suggest make note cards. And this was one note card I looked at every day when I was in nursing school, my antidotes. You need to know your antidotes because if the INR, right, which is the test that we monitor for Coumadin, the therapeutic level I want for Coumadin is for the INR is always 2 to 3. So if you get an INR of 5, what are you going to do? Stop. You're not going to give nothing. You're not going to give anything. If the INR is too high, it means the patient has received what? Too much of Coumadin. Stop. You don't give nothing else. You don't give an additional dose. You're going to stop that. antidote, right? And you're going to assess, because if the INR is 5, I'm going to assess for what? Bleeding, hemorrhage. Where can the patient bleed from? Everywhere. I'm looking for bleeding gums, nosebleeds, any unusual black tarry stools, hematuria. I'm looking for blood in their urine. I'm looking for their H&H if it's dropping. Their blood pressure might be dropping. Their stool is going to come back positive. Urine, NG, they can bleed from everywhere there's a hole, patients can bleed from. So you want to assess for those things, okay? And remember, this is always kind of important. Can Coumadin be given to pregnant women? Because I told you one of the risk factors was what? Pregnancy. Can pregnant women take Coumadin? No. It crosses to the placenta. It's teratogenic. It's not safe in pregnancy. So when you study something like a DVT, you see how you know the components? Take it a step further. So you can see how my knowledge of the content, can they ask me questions? Yeah. Can I answer them? Yeah. I know what I'm doing. I know the information. I know everything about Coumadin that's supposed to know. I even know all the foods that are high in vitamin K that the patient should not be eating. Like so the collard greens, the peas, the mayo, the Brussels sprouts, the broccoli, the avocado. This is how you study. Because when you know the content, there's not a question they're going to ask you that you can't answer. You know the material. I don't care who's asking you. I don't care if it's URL. I don't care if it's Archer. I don't care if it's NCLEX. You're going to know the answer. These, again, patients that have DVTs may be asymptomatic, okay? But a lot of them have signs and symptoms to that affected area. So you're always going to assess that area for edema, for pain, for tenderness, for color changes, and temperature of the skin. You're going to be checking capillary refill. You're going to be palpating pulses. You don't want them to lose that extremity, okay? And you have to make sure that patients know how to use their what? Compression stockings, okay? These help prevent DVT, okay? Education. What can I teach the patient to use? What can I teach the patient to do? How long do they wait? So again, these are very important things. So when you look and you're studying, you can see how in depth the case studies go in your knowledge, your understanding. So you want to get very, very comfortable with the material. So thank you guys for watching and staying. Okay, did you have any questions? No? Okay. So hopefully this was helpful to you, okay? And it guides you in your studying. DVT is always going to be tested on your boards. Always. I remember my little D-dimer question myself. Yes, it doesn't go away. Remember, DVT is one of those concepts that everybody can get. A pregnant woman, an older woman, people who don't move. So get very comfortable in your studies. Okay, stay encouraged, stay positive. And I'll see you guys next time. All right, have a good night.